All right, well, good afternoon. I am Marissa with New Lenox Fire.
And I am Jackie O'Hara with Manhattan Fire.
And today at TRIAD, we wanted to talk to you a little bit about CPR and how to do that for adult, children, and infant. We're also going to talk to you about choking for adults, children, and infants as well. Jackie's going to go over stop the bleed, so if someone has a severe bleed, what we're going to do, and then we're going to do some basic first aid with you all as well today. So if anybody has questions, we will try to do our best to answer them, but if we can hold off on those until the end of the presentation, if possible, that would be fantastic. And then we're also going to have time at the end of today to actually go through, and if you want to try doing CPR on an adult or the infant, or try to see what it's like to pack a wound, we're going to have some of that up here for you to try, whatever you want to do at the end of today as well. All right. So while we're getting this password up, we're going to go ahead and get started. So we're going to start with adult CPR. So really, if you remember, there are two main steps to doing CPR for an adult, and that's going to pop up on the next slide right here. All right, so basically you want to push hard and fast in the center of the chest, as well as calling 911. Those are the two simple steps when you are thinking about how to help someone who is having a cardiac arrest, and we need to jump in and do CPR. So you're going to find the center of the person's chest, and you're just going to press down hard and fast in the middle. Just like that.
Going to look something like this.
Yep. So you can see how they're right in the center of the chest, and they are just pressing down on it. You're going to go about 2 inches deep into the chest for both adults and children when you're doing CPR on them. Again, so the first step is calling 911. That way you know that your first responders are on their way as fast as possible, and then going ahead and doing that part. So if you can remember those 2 steps, you are already on your way to helping us out, because for every minute that we are not providing CPR to someone who needs it, the chance of survival drops by 10%. So being here and being just able to learn a little bit about what to do as far as compressions, anything that you can do, even if you don't know if you're doing them right, is better than standing by and doing nothing. So always call 911 first, and then start compressions as fast as possible. We do compressions for about 2 full minutes before you want, if somebody else is there, for you to switch out with, and you want to do that back and forth if there is someone else that can help you, because according to a lot of studies through the AHA, the American Heart Association, which is who we are both instructors through, for every 2 minutes that you do of CPR after that, the ability to do high quality CPR drops because you just get exhausted from having to do it. So the more you can switch off, the more people that are there that can jump in and assist you, the better the chance of survival for that person.
Very good.
And then in our area, it's usually about 4 to 10 minutes that you can expect before EMS can arrive. So depending on how close you are to the nearest piece of apparatus, like our ambulance or our engine, they're all cross-trained in our area, so everybody can do everything. The only thing an engine and a truck can't do that the ambulance can is transport.
Yep.
So that's why you're going to see our engines go out possibly and get there and start everything before an ambulance can, because they may have been closer. Yep. So again, the 2 things for children and for adults, right now for adults, is going to be call 911 and then push hard and fast in the center of the chest.
Yep.
Now, when it comes to children, depending on the size of the child, you may be doing 2-handed CPR, just like we did for adults, or if they're a smaller child, you can use 1 hand, and you can press down that way. That's these 2 pictures. You can kind of see this one, they're doing the 2-handed, and the other one, they're doing 1-handed. So it's just dependent on you. What is your comfort level? Your amount of strength that you have if you are trying to do 1-handed CPR, as well as, what is the third thing? So you, or the child's size. So obviously it's going to be easier to do 1-handed if it's a smaller child.
And it is important to know the difference of a heart attack and cardiac arrest. To identify that someone is in cardiac arrest and they need CPR, they are not going to be responsive. So you can come up to them after you check to make sure the scene is safe and you can approach, because we don't want 2 patients, we only want 1. If you tap and shout, "Are you okay? Are you okay?" They don't respond. They don't blink. They're not talking to you. That is unresponsive. That's a sign that they need help. So you would call 911 right away, as Marissa has stated. Breathing. Sometimes it gets confusing. There is something called agonal breathing or agonal gas. It looks something like this. If it is not normal breathing like you and I are doing right now, you're tapping and shouting and they're not responsive, they are in an arrest state and they need CPR right away. So we would call 911, we would get that help, and we would start chest compressions immediately. For a child or an infant, respiratory reasons are typically why a child or an infant would go into a cardiac arrest or respiratory arrest state. So it is important to make sure that we are preventing it. I know many of us have grandchildren or babies. RSV is something that is unfortunately kind of going around again. So when they say please don't kiss the babies, they're trying to prevent any kind of respiratory disease from coming or making that child ill or sick. To see if a child is in distress, they kind of wear it on their skin. You'll see blue lips, discoloration, same thing of, "Are you okay? Are you okay?" If they're not responding, they need help. So those are some things too that we want to make sure that everyone is aware of, that cardiac arrest is unresponsive, not breathing normal. A heart attack, there'll be different signs. They'll look at you, they'll talk to you, they'll say that they might have pain in their shoulder, their chest, their jaw, it'll radiate down. I've heard tingling in the hands. They could be sweating, or they feel like they just don't feel good, like they have flu-like symptoms. If someone is complaining of that, they need to see a physician right away. You can call 911 just to make sure they're not having a heart attack, because that can lead into cardiac arrest.
So as Jackie was saying, for a child and an infant, because a lot of times their cardiac issues could be caused by something that has to do respiratory, that is why I have put up there that you also want to be doing breathing with children and infants. So to do that, you are just going to do what we call the head tilt chin lift, where you take one hand and put it on their forehead, and take your other hand and put it on the bone part of the jaw, and you're just going to lift it up. Then you would take your lips and you're going to seal all the way around their mouth and plug the nose at the same time, and you're just going to do a normal breath. I always tell students when we're teaching, the smaller the human, the smaller the breath. That way, for a regular adult, we're just going to do a normal breath like we're taking. We don't want to take too big of a breath and push too much air in, because it's not going to go to the lungs, it's actually going to go into the stomach. So you want to make sure you're just doing a normal breath. So again, the smaller the human gets, the smaller size your breath gets, until you think of the size of an infant, which is just a tiny puff. Your breath of air should only be about 1 second each, and you want to do 2 breaths, and you want those to be no longer than 5 to 10 seconds total. So it would be, if I'm doing compressions and then I stop and I would say breath, breath, and then I can go right back into it. You just want to see the chest rise and fall. It doesn't have to be a big rise and fall, but just enough to see it slowly rise and fall.
Yep.
Okay.
And so for adults and teenagers, if you're not comfortable giving breaths, hands-only CPR is extremely effective. So you could just can give continuous compressions. You don't have to stop, just keep going. You could get tired after a while, so if someone else is there, jump in. But just as Marissa said, with children and infants and someone who is drowning, breaths are very important.
And then it's 30 compressions to 2 breaths is what you want to do. That's the ratio. So if we want, I could do 30 real fast.
Yeah, go for it.
That way you kind of have an idea how many it is. So it's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 5, 6, 7, 8, 9, 30. Breath, breath.
And then she would keep going for 2 minutes. Now, another thing too to note, if the person is in, let's say a child is in a crib or the adult is on a bed or a couch, if you can put them on a hard, flat surface, it's better to do CPR on a hard flat surface versus on a bed. So that's really important. And you can see, as Marissa, can you do your compressions again? How far into the chest she really has to go. It's got to be 2 inches and to a tempo of 100 to 120 beats per minute. So a song sometimes is helpful. Staying Alive really truly is the song to do CPR to. If you're a Star Wars fan, the Star Wars theme song, you can do CPR to that as well. Spotify actually has a playlist where you can hear 100 to 120 beats per minute. I believe
Don't drop the beat.
Don't drop the beat is what
the
it's
name of
called.
it.
Yep. And Journey also has a song that is 100 to 120 beats per minute.
And
but
if
it does
anybody
help.
knows Baby Shark
Oh,
from
Baby Shark.
your little
Grandchildren.
kids,
Yep.
then you can do it to Baby Shark too.
Absolutely. Absolutely.
So find a favorite song that's 100 to 120 beats per minute. Again, most people use Staying Alive just because it's one that we hear all the time, but you just want to do it to that rhythm, basically.
Yep. And then at the end of our presentation, if you would like to try, we'd be more than happy to let you go ahead and do a few compressions, see how it feels. And another thing to add, when you call 911, please make sure you stay on the phone with them, put it on speaker, let them know, okay, the person, I think they've been unresponsive for 5 minutes. I just found them. They'll ask you, dispatch will say, can you count out loud? So that way I can keep account of how many compressions you're giving. And they'll be communicating with the fire department, letting us know, okay, they've been doing 5 minutes of CPR, the person is unresponsive, they are in the back bedroom, X, Y, and Z, and they'll continue on. And then when EMS arrives, they'll just pull you aside, ask a few questions, and then they'll continue their work from there.
Okay.
Okay?
All right.
Any questions
So far we've done adult and child super fast.
Yep.
This is normally about a 3-hour class to
Yes.
teach a lot of what we're teaching you today. So when it comes to infant, it's basically the same as far as the 30 compressions to 2 breaths that you were going to be doing. However, this is because it's a small human, this is when we're going to be changing how we do our compressions. You can see here, again, you want to check for responsiveness. So instead of tapping and shouting like we did with the adult, this time we're going to touch and tap and tickle and flick the bottom of the foot of an infant because they have more nerve endings down there. And obviously we don't want to shake a baby, right? So we're going to see, baby, are you okay? If they're not doing that, we're going to check to see if there's any breathing. They're not breathing, so I'm going to go ahead and I'm going to start my compressions. The first way is the 2 fingers, where you're going to find the center of their chest. You're going to put your 2 fingers there. Again, we want a hard, flat surface. So if you're at a park, something like that, you know, pick them up, put them on a park bench, put them on a picnic table. If you don't have those, if there's a merry-go-round or something like that that's going to have that flat surface, go ahead and use it. So I have my 2 fingers. This time I'm pressing 1.5 inches down. And I'm just going to go ahead and compress like that. The other way you can do it is called the 2-thumb encircling, where I'm taking my hands, I'm putting it around the baby, and just so you can see where I'm putting my thumbs right there. Plus, I also have my hands around them, so I don't have to worry about any rolling or anything. I've got good, stable control. And then I'm just going to press down with my thumbs. Personally, I like that one better than the 2-finger, but that's why I want everybody just to try it. If you have babies in your family, if you want to learn a little bit, just come and try that here at the end of class.
And an infant is considered 1 and under. So you would do this for, if it's a smaller child, 1 and under is what you would do this for.
When it comes to breathing, we don't want to push the head and neck back quite as far as what we do with children and adults. Because if you think about an infant, their airway is about the size of your pinky. And I always tell my students, it's kind of like a bendy straw.
Yep, thank you.
So if they move too far forward or if the head moves too far back, what happens? The airway becomes blocked, right? So instead you want to try to make sure that the neck stays in a pretty stable area. So we do what we call is the sniffer pose. So if you had walked in here and we had amazing food that you could smell without even realizing it, you're walking into the room and you're like, what is that? That smells great. So you just tilted your head up just enough. So you're going to go ahead and tilt it up. Now there's 3 ways that you can do mouth to mouth. You can do your mouth to their mouth, again where you're plugging their nose. You can do your mouth to their nose, but you close their mouth, or you can do your mouth around their nose and mouth. which to me almost
That's-
makes the most sense because they have such tiny little features that you're able to put a good seal around their nose and mouth that way.
And their little noses, sometimes that airway is very small. It could be clogged, especially if they're ill and they're not feeling well. So that way you can blow that air into the airway and it's not going to miss it anywhere. You'll have a good seal, so mouth to nose. In all honesty, I just taught this yesterday. My deputy chief agreed that is the best way, in our opinion, to give mouth to
nose and mouth?
Mouth to nose and mouth, yes.
Okay.
Absolutely.
All right, so this is another little quick video that you can watch. They are using a bag mask, which is similar to what we would have, but you can see how they have it around the nose and mouth there. And then she just goes right back into compressions.
Yep.
Pretty easy with the little ones.
All right.
And then this is the 2-thumb encircling, so I wanted to show you that as a video as well, so you can kind of see. I know I was showing you, but it's nice to have it up here too, where it's easier to watch. All right. If you want to talk about choking.
Choking, okay, so choking. Now typically when Marissa and I teach this to our students, we like to cough and pretend one of us is choking and then, oh no, are you okay? The whole scenario. So I won't do the dramatics with Marissa, although we are very good actresses, I must say. But if someone is choking, it's very important that we know how to identify that they're choking. Now, if Marissa were eating a piece of steak and she's enjoying the steak and she's eating it and she starts coughing, is she choking? Do you think she's choking? Not necessarily. She might be choking a little bit and it's starting to be clogged, that airway, but she's coughing, which is a great thing. That means the air is still moving, she's still breathing. So Marissa, could you start to cough for me? Marissa, are you okay? So I would continue to ask her, are you okay, are you okay? And if she's coughing, keep coughing, that's good, that's air movement. But once it stops, she's gonna do the universal sign. Some people might do this. Smaller children might run to the bathroom because they want to throw it up and they're too embarrassed to do it in front of maybe their peers or at home. But you'll be able to know as soon as there's no air movement, they're not breathing, they might just start to turn red or blue or discolored, they need help. And that's when we would ask, can I help you? Are you okay? No? Okay.
Yeah.
Then I would approach and I would stand behind Marissa in a stance that would be supportive of my posture and hers, because if she collapses on me and I'm standing straight up, timber, we're all going backwards, right? And that could be not so good. It could cause an injury. We could both get hurt at the same time. So I'm going to bend my knees, so I'm in a good stance to catch her. I would, and if you would like to do it with me, you can. I would take my hand, bend my thumb, curl my fingers into a fist. With my other hand, find my belly button. And above the belly button is your diaphragm, and that's where your fist is going to go. With your other hand, grab onto your fist, and you would, and please don't do it too hard to yourself, but you would very forcefully give upward thrusts into the diaphragm.
So you can just try it gently on yourself right now.
Yep. And it's going to be, when you're doing it to someone else, very forceful, because you are trying to dislodge that object out. Essentially, you're trying to push that air up and out so the object comes out.
So you're becoming the cough for that person.
Yep. So what I would do is this, okay? I'd find Marissa's belly button, and I would come up to her diaphragm, and I would make sure that I would be able to catch her and myself, and I would give her very forceful abdominal thrust. You can do 5 or until the object comes out. If it does not come out and the person becomes unresponsive, and I'm in this position, I would be able to catch them and bring them back to the ground. Don't
Sorry,
fall.
I'm not gonna let.
But that is just kind of an example of how to relieve if someone is choking. If the person is pregnant, what you would do for them is you would do the same hand movement, but you would go in the center of the chest, kind of like in the area where you would give abdominal thrusts compressions to someone when they're doing CPR. But that's where you would put your hands. If the person is too large for you to be able to wrap your arms around, you could go to the chest again too.
Right
Or
here.
if there's 2 people, you could go like this.
Oh,
You can grab me at the hair. Just around the person.
and you can do it together.
Yep. If the person is in a wheelchair and unable to stand them up, you would just go right behind them.
Do you want me to sit?
Sure, go ahead and sit, Marissa. This is perfect. And I would do the same motion. I would go behind them, but I would come into the center of the chest here. If you're by yourself and you don't have someone to help you, you would take a chair, you would take a table, and you would just give abdominal thrust to yourself, just as Marissa is doing, to get that object out. See? There you go. And that is how you relieve a choking person. Now, if it's a child and they're this tall, do you think if I bend over them, it's going to be as effective for me? Probably not. So I would kneel on the ground. That way I'm able to get around the child, and if they fall, I can hold on to them and catch them. But this way it'll be a little bit easier for me to give them abdominal thrusts. Now, an infant will be very different, though, when we go to an infant. Marissa, would you like to do the infant?
All right, so with an infant, if you are guessing that it's probably that they are choking, all right, so you're going to make a C with your hand and put it under the child's chin. Because again, with an infant, you always want to make sure that you are supporting the head and the neck of that child. And then I'm going to take my hand and find the shoulder blades of the infant. I want to hit actually between the shoulder blades. So it's going to be not crazy forceful, but still a pretty substantial back blow.
You're going to want to have to hit them hard. I hate to say that, but you will have to hit them hard.
Yes. Now, I personally turn my hand. One, it's more comfortable for me, but I turn it so I don't accidentally hit the back of the baby's head. Another thing you want to make sure when you are doing choking for an infant is that the head is always facing downward to try to get gravity to help us force whatever the object is out. So I'm going to start with 5 back blows. 1, 2, 3, 4, 5. Remember, it's a plastic baby, right?
Yeah, but you do have to hit. You do have to hit them hard. Okay.
And then I'm going to take
Flip
my
them
other
over.
hand. I'm going to place it here. So again, I'm supporting the head and the neck. I'm flipping that infant over, and now I'm doing 1, 2, 3, 4, 5 chest compressions. Thank you. So sometimes it is easier if you are sitting, that you can just keep going back and forth between the two. And you're also making sure that that head is down and you're supporting the weight of that child. So again, 1, 2, 3, 4, 5. Flip them over. 1, 2, 3, 4, 5.
And we want to avoid blind finger sweeps. A lot of times people think, oh, I can just get in there and just get it out with my finger. When you do that, you could actually push the object further into the esophagus and cut off the airway some more. You could unfortunately scratch them a little bit, but they could also bite down. So we want to avoid that. We want to remember too, a child's airway, think of a funnel and a marble. Okay, if a marble is blocking the funnel, what's going to happen? It's going to just sit on top. But with gravity, when we're doing the back blows and we're pushing them forward this way, the marble's going to fall out. So by us just doing this, it's going to already start to help with that. Now, like Marissa had mentioned, gravity is our friend. A lot of people are tempted to go, did it come out? And what's going to happen?
Back in.
Back in. That marble goes back in, and we want to avoid that. And a lot, too, sometimes people in an emergency, my baby is choking, my baby's choking. Just by doing this motion and the back blows, and I mean hard, unfortunately, it's going to help dislodge that object. Okay?
Now, whether it's an adult, a child, or an infant, if they become unconscious, that's when we're going to start with CPR. The only difference is going to be that in our breaths, when it's time to do the breath, you do want to look in their mouth to see if there is any object that is coming out. If you can easily take it out, go ahead and grab it. If not, if it still looks like it's kind of stuck in there, don't put your fingers in because you don't want to push it back down. Okay?
Yep.
All right. So you're going to be able to watch, I think this here is going to show you too, where she's doing the 5 back blows. It's in slower motion, but she grabs the back of the head, flips the baby over, and does the compressions again.
There you go.
All right, now we're going to talk about first aid.
Yeah. So we basically, in a nutshell, are trying to teach you 3 hours worth of CPR in a very short window. Marissa and I both do teach CPR in Manhattan and New Lenox, and quite often we end up teaching it together. So if you are interested in getting certified, if you do have grandchildren that you take care of and you want us to check your car seats, you can always reach out to the two of us as well. We'd be more than happy to schedule a time with you to get certified. So basic first aid, here we go, the next portion.
All right, so this time of year, we think a lot about if we're outside, we haven't been outside for a while, we forget our sunblock. What happens? We get sunburns, right? So whether it's a sunburn or if we're cooking and we accidentally burn ourselves that way, these are usually, hopefully, going to be somewhat minor burns. So you're gonna just see slight discoloration on it. As it becomes more severe, you're going to start to see more blistering to the effect where if it's a very severe one, it's going to be more like it turns black. And that's definitely when you need us to come, and we're going to have to take it from there. But for minor burns, quick cooking burns, sunburns, those kind of things, you want to stick it under cold water.
And cool the burn.
Yep, for at least 5 minutes. That's trying to take a lot of that heat out. You never want to put, and I've had people tell me, oh, Vaseline, we put butter on it, all those kind of things. That traps that heat in, so it's going to make the burn worse. So there's only really a few products out there that we would say go ahead and put that on. But the number one best thing to do if you have a burn is to cool it down.
Yep, cool it down.
So try to do that for 5 minutes and then wrap it if you need to in a dry bandage that's going to protect it so it's not getting constantly rubbed and irritated as well.
If it blisters and it's the size of your palm, that's a very severe burn that should be checked out. I know a lot of times people are like, oh, I'll just pop the blister. If we pop the blister, it's going to get infected and it's really painful. But if it does start to blister, you know, it is painful, keep an eye on it and call a doctor and go get that checked out because we would hate for you to have an infection.
All right, nosebleeds.
Nosebleeds.
A lot of people have been taught in the past that you not just want to pinch it, but that you want to lean back or lean forward, but instead you actually just want to remain upright, whether you're sitting or if you are standing. Pinch the nose and just make sure that you just keep pinching it. Never blow your nose after you get it stopped because that can start it all back up again. If it doesn't stop after 10 minutes, try to reapply it. If it's a really bad nosebleed, you can always contact 911 and we can come and assist you with that. We do get calls for nosebleeds.
And I always see little kids doing this at the park.
Yep.
And I feel so bad because all the blood is going to run down the throat, and I think we've all experienced that in our own childhood, in our own lives. So the big thing with little kids too, if you're with your grandchildren and they fall, they get a nosebleed. If it's humidity related, just have them stay calm. You could put that compress on their nose, give them even something cool to drink. Having your gums cooler will also help with that too. I've learned, unfortunately, from my own experience about nosebleeds. I had them a lot as a kid, so just make sure that they don't swallow the blood.
For stings and bug bites, I know I got stung a couple years ago, and I remember how bad it hurt for several days after, actually. So if you are with someone who does get a sting or a bite, or you do, if it's something that has that stinger in there, you always, obviously, for anything like this, wash it with soap and water. But if it's got the stinger in it, you can take a credit card, and let's say I got stung right here, I could take it and I could push it next to my skin to try to get it to pop out. So that's one way to go ahead and do that. Apply cold packs. That's going to take that swelling down. It's going to hurt or take away some of that hurt because the swelling is going down. If they are allergic, because we all know people who are allergic to bees, to wasps, to hornets, those kind of things that have stingers. So that's when they may have something like an EpiPen. For any kind of an allergy, if you or any of your family or friends are allergic enough to need an EpiPen, it's always good to try to play with a trainer, which is what we have here. So when I show you how to use it in a minute, I'm not putting a real needle with drugs into my skin. I promise you it's just a trainer. I've scared people that way when I forgot to mention it was a trainer. They're thinking, no, what did she just do to herself, right?
And it is important that you do follow directions, because unfortunately there have been situations where people don't follow the directions, and when they go to inject the EpiPen, they push the wrong side and it actually injects them in the thumb. So we don't want that to happen, just a heads up.
So this is usually what the kind that you're gonna see is gonna look something like this. You're gonna take this blue part out. Then you're going to take it in your hand. Never put your thumb again over this side. Instead, make sure that your hand is in the center. You're going to find the side of their pants, or her pants, the side of their leg, like their thigh, and then I'm just going to push it in there. I'm going to hold it for 5 to 10 seconds, and then I'm going to release it. When it releases, this part is now over the needle, so you shouldn't have to worry too much about that. Just always be careful anytime a needle is involved. Okay. So that is this EpiPen. I have another one that I can show you here really quick as well. And this one's called the Avicu. And this one pulls out. This one tucks.
This trainer contains no needle.
And just like the other one had a little safety thing, this one does here too. So I pull the red off.
Place black end against outer thigh.
So here I'm placing it again against my outer thigh.
For 5 seconds. 5, 4, 3, 2, 1.
Injection complete.
And complete.
I've done that a time or two. So anyway, this is an Avicu, is what this one is.
And to identify when someone needs an EpiPen is really important as well. We want to make sure that we know that, okay, now is the time we use this. There could be swelling in the lips. They could have a hard time breathing, break out in hives. Children will sometimes say, when they're having an allergic reaction, I feel like there's fuzzies in my mouth, there's a frog in my throat, I can't breathe. You'll be able to notice, especially if there's a lot of swelling and hives. If the person becomes unresponsive, you have to give them rescue breaths. You might have to do CPR because the body is attacking the allergen. That's why as soon as you possibly can, if they're having an allergic reaction, give them the EpiPen. It's really important to do so.
And then make sure that you contact either 911 or get them to the hospital or to a doctor as soon as you have to administer it.
Okay. Minor scrapes and cuts. So for minor scrapes and cuts, it's important that we just stay calm. When we say minor, that means that, it's a surface, you get scratched, you fell down, you cut your leg, it's not pulsing, there's not blood shooting out. So for these minor injuries, what we're going to do is we're going to try and clean off the surface if we can. We always wear protective equipment like gloves before we touch anything with blood. Then we grab some gauze, a Band-Aid, and we're going to apply pressure. It's really important to just, if it's on the arm, you can lift it up so that way the blood flow goes down to the heart, which, it's our heart. We got to have that blood, right? And then afterwards, just clean it off with water and apply some Band-Aids. We just want to make sure that that area does not get infected. I know a lot of us have grown up and been told to put peroxide on it. We do not advise that you put any peroxide on it or alcohol. Just make sure that the wound stays clean. If you want to put some Neosporin or some type of a cream like that on there, you're more than welcome to do that. But peroxide actually really hurts a lot, and there's not really a benefit to it. So just keep it clean and put some Band-Aids on it. Okay, so this is where we're going to get into bleeding control. Now I know some of us in this class, I should say, in our TRIAD committee have done some stop the bleed training in the past, which is wonderful. So what we're going to do today is just very briefly go over what we need to do if there is a severe injury, whether it's something that happens at home, you get cut by something in the yard, or if unfortunately we are in an event in our community where there's a life-threatening injury that has occurred, you know how to prepare yourself and what to do. So, how to treat a life-threatening bleed. A lot of times people immediately say tourniquets. Show of hands, who has a tourniquet on them right now? I see no hands going up, right? So not many of us carry tourniquets on us. So in this situation, we're going to need to learn the ABCs. And what are the ABCs, Marissa? For stop the bleed. This is what we're going to learn today. We're going to learn to alert. So first, we need to call what number?
911.
911. Thank you, Ed. That is the number that we're going to need to call in this situation. We're going to need to let someone know, oh my goodness, we need help. How to identify if it's life-threatening? If it's a minor cut from us falling off a bicycle, okay, if it's a little bit of blood, we probably don't need to call 911. But if we see that there's pooling, there's a lot of blood, it's starting to squirt out, we can't get it to stop. That is life-threatening, and we need to take immediate action on those kinds of injuries, okay? The B, we have to find the source of the bleeding. If someone is laying on the ground, after we check the scene to make sure it's safe for us, we need to see where that pool of blood is coming from. Is it coming from the chest? Is it coming from the leg? Is it coming from a finger, a hand? Where is that bleeding coming from? Once we identify it, if you're able to, remove clothing from that area. If you have some trauma shears in your first aid kit, you can cut the jeans, which again, I don't know many of us who probably walk around with a trauma kit, but if you could pull it up or rip that area just to see what kind of injury this person has, it's very important. And then the next step is to compress. So if you do not have a tourniquet on you, depending on the injury itself, applying pressure is very important. And I have some examples up here of different kinds of injuries. And after we're done with our short presentation, I'd be more than happy to show you exactly how you're going to pack different kinds of wounds, okay? We have lacerations, we have puncture wounds, we have these cubes that we'll use too, and I'll teach you how to pack as well. But the big thing, and I think I left the gauze over there. Marissa, could you grab me some gauze? Is if you do, please make sure you can, and again, I don't know many of us who carry gloves on us, put some gloves on. Is it back here? I think they're over there. It might be over there in the back. If you don't have gauze on you and you have maybe a flannel or a shirt available or around something, or even the person's shirt, grab something that can absorb, and you're gonna just put it on top of the source, and you're gonna just apply pressure. You're gonna push as hard as you can down on that pressure to hopefully stop that bleeding, okay? If you're unable to stop the bleeding, you can then take the t-shirt, preferably clean, but if you don't have clean, that's okay, or gauze, and you can just start to push it into the wound, okay? And while you're doing that, we want to make sure that it really gets in there, and we're going to apply pressure. We do not want to let that source of pressure go, so we don't just let go. We're going to hold that down until medical help arrives. If you do have a tourniquet at that point in time, now tourniquets are used as more so of a last-minute resort. To use a tourniquet, it's fairly simple. You would take it out of its package, unvelcro it, and I'm just using this for an example. You would apply it 2 to 3 inches above the injured area. We don't put these on joints. That's really important to know. You'll put it on the person, depending on the location. Then you're going to take this little plastic piece here, and you're going to twist and twist and twist and twist until it's tight enough. You can't twist it anymore. My Velcro's a little too tight there. Then you're going to clasp it. And you'll write the time that you put the tourniquet on the tourniquet. So that way when they arrive to the ER, they know, okay, this tourniquet was applied at 2:45 p.m. Please don't take the tourniquet off once you put it on. So that's really important to learn and to know, and we can practice this afterwards. But this is only in severe, 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 severe cases where you can't get the bleeding to stop. It could be an amputation, it could be shooting out, and it's just uncontrollable at that point in time. So that is how you apply a tourniquet. So go ahead, Marissa, and as you can see here, wrap, wind, secure, and time. Pretty important. Go ahead and push the next one. So at the end, I believe that's the end of our presentation right now. We do have some cubes available that you can go ahead and put some gloves on. We'll practice how you can pack a wound, how to put on a tourniquet, how to apply direct pressure. Marissa will also walk everyone through the steps of doing hands-only CPR. If you have questions for us, we would love to answer them, and hopefully we can help you, with anything that you need in the future. And that's it. Yes.
TRIAD works to improve the quality of life for seniors by providing an opportunity for the exchange of information between public safety, social services, and seniors. There are no membership papers to fill out or fees to pay. Everyone is welcome to attend. Each month, we present a guest speaker on subjects that keep you informed and up to date on the latest scams, frauds, and other criminal activities. We also discuss safety issues, home preparedness, and staying healthy. TRIAD meets the fourth Thursday of every month. Contact the New Lenox Police Department at 815-462-6100 for more information.